The first test was ulnar deviation range of motion. Have the subject put their hand flat against the table. The stationary arm bisects the radius and ulna. The mobile arm follows the third metacarpal, and the axis of rotation is the capitate. The muscles causing ulnar deviation are the extensor carpi ulnaris and flexor carpi ulnaris. This motion occurs in the frontal plane, and the axis is the anterior-posterior axis. Normal range of motion for ulnar deviation is 30 degrees. The subject had an ulnar deviation range of motion of 29 degrees. The second range of motion assigned was hip abduction. Have the patient lie supine on the mat table with legs extended straight and neutral rotation. Have the subject perform hip abduction by sliding the lower leg laterally. The stationary arm is an imaginary line from the ASIS to the other ASIS. The mobile arm follows the midline of the femur, and the axis of rotation is the ASIS. The muscles causing the action are the glute max, glute medius, glute minimus, TFL, and sartorius. This motion occurs in the frontal plane. The axis is the anterior-posterior axis. Normal range of motion for hip abduction is 45 degrees. The subject had a range of motion of 43 degrees. Make sure to look for external rotation and flexion of the hip. The next range of motion was thoracolumbar flexion. This range of motion test was done using the fingertip to floor method. During this test, the subject stands with feet hip width apart and legs straight. Instruct the patient to flex forward and touch their fingertips to the floor. Measure the distance from the fingertips to the floor. Normal range of motion from fingertip to floor is 0.1 to 2.2 centimeters. The muscles causing this action include the rectus abdominis, external and internal obliques, as well as the transverse abdominis. This motion occurs in the sagittal plane, and the axis is the medial lateral axis. Next, manual muscle tests were performed. The first MMT was extensor carpi radialis. Have the patient sit with their forearm resting on the table and palm in extension and radial deviation. The muscles involved include the extensor radialis longus and brevis. Stabilize at the forearm with one hand and provide resistance at the metacarpals into ulnar deviation and wrist flexion. The grading of this test was a 4. The origin of the extensor carpi radialis longus is the supracondylar ridge of the humerus. The insertion is the base of the second MC, and the action is wrist flexion and radial deviation. The origin of the extensor carpi radialis brevis is the lateral epicondyle of the humerus. The insertion is the base of the third MC, and the action is wrist extension. Since there are two motions going on during this test, there are two planes and two axes of rotations. The first plane is the sagittal plane. Axis of rotation for this plane is the medial lateral axis, and this happens for wrist extension. For radial deviation, this occurs in the frontal plane, and the axis is the anterior-posterior axis. The next MMT was the extensor digitorum. The origin of this muscle is the lateral epicondyle of the humerus. The insertion is the middle and distal phalanx digits 2 through 5, and the action is that it extends the MP joints at digits 2 through 5 and also assists with IP and wrist extension. This motion occurs in the sagittal plane. The axis is the medial lateral axis. Have the subject sit down with forearm pronated and supported on the mat table. With one hand, Stabilize the wrist joint. Instruct the subject to extend the MCP joint by bringing her knuckles as far back as she can. Resist the proximal phalanx into flexion. The grading for this MMT was a 4. The last MMT was lumbar trunk extension. Have your partner lie prone on the mat table. Stabilize at the ankle joint. Have the partner extend up as much as possible. Have the subject hold this position for 5 seconds. This MMT was graded as a 5 because she showed no signs of fatigue after those 5 seconds. This motion occurs in the sagittal plane and the axis is the medial lateral axis. The muscles working to produce this movement are the erector spinae and deep stabilizing multifidus. Here is the origin, insertion, and action of the erector spinae. Here is the origin, insertion, and action of the multifidus.